Welcome back. Just chatting here with Adrian Divittorio with Mobile Infirmary Health, Diagnostic and Medical Clinic, and we're talking about new tech as it relates to lung cancer. First, tell us the name of this new system.
Ion navigational bronchoscopy.
Okay, and how are you using that?
So a navigational system, in particular ion navigation, allows us to robotically navigate to the smallest nodules in the lungs. The lungs have essentially over 30,000 divisions. So when we diagnose a lung nodule, it's quite challenging to actually tell a small little camera or robotic lesion to get to that lesion. And so this technology allows for a lot better precise and early diagnosis of potentially a lung cancer.
And we know when it comes to cancer, early is best in terms of your chances of beating it. Talk to me about how those nodules developed, what symptoms a person might have.
So unfortunately, with respect to lung nodules and lung cancer, like I tell people, we often diagnose it by mistake. Somebody gets in a car wreck, they get an x-ray, and lo and behold, they see something. Wow. So the symptoms of lung cancer can be absolutely nothing. When very advanced, that's when we may see some of the symptoms of cough and breathlessness, which is very nonspecific. So the most important thing for lung cancer is an early screening program where we can detect a lung nodule through a CAT scan at a very early stage, and then go after it, get an early diagnosis, and have a team of healthcare providers lined up, including thoracic surgeons and oncologists, to get on this immediately.
I want to get back to this treatment here that you have, because we talked about earlier how it allows you to go deep inside the tissue there. Can you explain that more?
Correct. And with the ion navigation, what it's allowed us to do is they've gone through so many variations of bronchoscopy that this technology is so much more advanced that we can truly get out there a lot deeper. So the depth of penetrating into the lungs, especially for small lung lesions, is a lot better. And you have to remember, when you go get a biopsy, the first thing your doctor tells you is don't move.
Right.
You can't tell the lungs not to move because you have to breathe, and you have the heart in the chest while moving it. So the ion navigational system allows us to get our catheter almost directly on top of this lesion, and then using some very fancy software and ultrasonography, we can actually visualize it in some instances, and we have a pathologist in the room that tells us right then and there that we have appropriate tissue diagnosis.
And I know you said sometimes there aren't any symptoms, but what about the causes? What causes lung cancer?
So worldwide, inevitably, the main cause of lung cancer is smoking. Smoking of just about anything, cigarettes in particular. However, I do have maybe a 10 to 15% population of patients who have never smoked and have developed lung cancer as a non-smoker. There are other known occupational exposures that can cause lung cancer at a very small percentage. But still, present day smoking is the biggest culprit. That and aging.
Yeah, well, there's nothing you can do about aging.
Exactly.
Well, thank you so much for stopping by and talking about this new technology. It's great to have it in our backyard.
Absolutely.